I invite you to place your hand over your heart. As you feel the beat of this muscular organ, think about what it does to sustain life for you. It is the force behind the pumping of blood to the lungs to pick up oxygen and the pumping of blood to deliver oxygen and nutrients to your entire body. In 1 year, the heart pumps an estimated 1 million gallons of blood and beats approximately 40 million times. A daily estimate is 2,700 gallons of blood pumped and 100,000 beats. Add the fact that blood is pumped through an estimated 60,000 miles of vessels in your body, and the heart becomes even more phenomenal. The heart has fascinated and intrigued man for centuries and still today is linked with human emotions. Your goal in this chapter is to learn the gross anatomy and functions of the heart and its structures, how blood moves through the heart, and circulation continues. So the objectives here, you can look on your note sheet. Orientation of the heart in the thorax. Hopefully you already know that the heart resides in the thorax. Explain the circuits of blood flow, the gross anatomy of the heart, the blood flow to the heart muscle itself, the histology of the heart muscle tissue, the electrical conduction system of the body, and disorders of the heart. So, the location of the heart, well, just a few fun facts. It typically weighs 250 to 350 grams. That's a healthy heart. And that's about, a little more than half a pound. It's the largest organ of the mediastinum. Please understand what the mediastinum is. It's the area between the lungs. Superiorly, it's bounded by the thoracic inlet and the diaphragm inferiorly, the lungs laterally, the sternum anteriorly, and the vertebral column posteriorly. And it is further divided into superior and inferior portions. It's the inferior mediastinum in which the heart resides. So if it's in the mediastinum, you don't even have to say it's located between the lungs. It basically is, I would say, sort of square-shaped with a point. So the point lies to the left of the midline. The heart basically is on the midline. And the base, remember if we have an apex and a base, then we have a rough triangular shape. Well, because there's a point, I guess they call it triangular. So the base is considered the posterior surface, or it faces the left shoulder. The heart is a double pump. One side pumps blood to the lungs and the other side pumps blood to the body. So up here, this is the heart and where it resides in the thoracic cage. Here's our thoracic cage, and remember, it's the thoracic cavity is bounded by the diaphragm. Sorry. I'll try that again. Still trying to get to learn how to do this. Okay. So here's the diaphragm. Right? It's higher on the right than the left because the liver is in this area here. The liver is like this big. So the heart, you can see, is basically on the midline. It's slightly to the left. It lies on top of the diaphragm. It actually has tiny ligaments that attach the pericardium to the diaphragm. You want your organs to fairly much be locked in place so they don't go spinning off all around your body. So this is mid-sternal, so you can see that the anterior border of the heart would be the sternum. The second rib would be the superior border of the heart, right? So over here you can see these little ligaments that connect the pericardial sac to the diaphragm. If we take a transverse section, cut the heart in half, and look at it, you can see that it's just slightly off center to the left, but not as much as maybe you have imagined. So again, the mediastinum is between the lungs, with the thoracic inlet superiorly and the diaphragm inferiorly. The heart is in contact with the diaphragm, okay? In contact. It's actually stuck to. And if you look here, here's the heart. And sometimes the lungs actually cover most of the heart. I've seen some that cover most of the heart. Okay, everyone's a little bit different. So the apex of the heart is down here, and then the base would be posterior. This is the right ventricle here, the left ventricle. This is fat, superficial fat. This is the right auricle of the right atrium and the lung. Oops. So the four corners of the heart, you need to know where these are so that you can listen for heart sounds, and then you know if it's of normal size. You can see the heart on an x-ray, and this is where these will come into play. The superior right, that is the patient's right, is at the costal cartilage of the third rib and sternum. So if we go back, superior right, right here, third rib, 1, 2, 3, third rib, and the sternum. See? So you should get a picture of a heart and note these four corners. Inferior right, the costal cartilage of the sixth rib, lateral to the sternum. The superior left costal cartilage of the second rib, lateral to the sternum. And inferior left, fifth intercostal space at the mid-clavicular line. So these are the two circuits. So that's a double pump. So the right side is one circuit that goes to the lungs, so it's called the pulmonary circuit. The other side goes to the body, so it's called the systemic circuit. So we're dealing with three separate circuits of blood because we also have the flow of blood to the actual heart itself, the coronary circuit. So the pulmonary circuit goes from the right ventricle, this is the right ventricle, up to the lungs. It gets oxygenated, it comes back to the left side of the heart where it will be pumped out to the rest of the body. The coronary circuit exits posterior to the aorta after it leaves, and that will come around each side and innervate the actual heart muscle. So the blood supply to the heart are called the coronary arteries. They arise from the aorta on the posterior side of the heart in the coronary sulcus, and we'll point that out later. And the main branches are the left and right coronary arteries. Those will come around to the front and then descend in a very orderly fashion. So here's the description, and you'll have to look at a heart while this description is being played, and I'll give you an MP3 of this and you can look at a heart. So the left coronary artery, and we say LCA, arises from the left side of the aorta. It passes posterior to the pulmonary trunk, then divides into two branches, the anterior interventricular and the circumflex. The anterior interventricular artery is referred to as the left anterior descending artery, or LAD, and runs inferiorly down the interventricular septum. The septum, again, is just kind of an indentation, and the anterior walls of both ventricles. The circumflex artery, denoted as CX, follows the coronary sulcus posteriorly and supplies the left atrium and the posterior part of the left ventricle. The right coronary artery, RCA, emerges from the right side of the aorta and descends in the coronary sulcus on the anterior surface of the heart between the right atrium and right ventricle. At the inferior border of the heart, it branches to form the marginal artery. Continuing into the posterior part of the coronary sulcus, the right coronary artery gives off a large branch in the posterior interventricular sulcus, the posterior interventricular artery. Clinically, this artery is commonly called the posterior descending artery, or PDA. The right coronary artery and its branches supply the right atrium and much of the right ventricle. As for the veins, the cardiac veins collect blood from the arteries and returns it to the right atrium. The largest vein is the coronary sinus. It occupies the posterior part of the coronary sulcus and returns almost all the venous blood from the heart to the right atrium. Into the coronary sinus drain three large tributaries: the great cardiac vein, the middle cardiac vein, and the small cardiac vein. So this is what they look like. If this is shaded a little bit lighter than this one, that means that it's posterior. So this is the aorta. So posteriorly, the left coronary artery goes behind the pulmonary trunk here, and then it branches into the circumflex and the anterior interventricular arteries. Okay, so the right coronary artery descends between the right atrium and the right ventricle, descends down, and then branches off into the marginal artery. It's not that difficult. Sorry. The veins, from the anterior, we have the small cardiac vein down here, and we have the great cardiac vein anteriorly. These are the two anterior veins. Posteriorly is the middle cardiac vein, and then the coronary sinus on the posterior surface of the heart. And that will drain right back into the right atrium. Okay, moving on to the coverings of the heart. The heart obviously is very fragile and it needs a lot of protection. It has two main sacs that it lives in. One is this very fibrous, very tough. Remember the dura? It's similar to that, but not as hard. It's like soft leather. It's called the fibrous pericardium. Now the visceral pericardium, or sorry, the visceral pericardium, serous pericardium is what I mean. Serous pericardium has two layers, the parietal layer, and it folds in on itself, and this is the visceral layer. So this, the pericardial sac, is this one. That's the fibrous pericardium. The serous pericardium, and serous because there's a serous fluid in here, which reduces friction from the heart pumping. And this is two layers. We're going to find this in the abdominal cavity as well. The parietal layer is the more superficial layer, and the visceral layer is in contact with the outer layer of the heart, which is called the myocardium. Okay? And then this layer here is called the endocardium. And endocardium is made of epithelial tissues, right? Okay, the pericardium, two primary layers, the fibrous pericardium and the serous pericardium. This is very, very, very strong, and you can see it on the cadaver. The serous pericardium, you can only see the outer layer, you can't see the two layers. So the parietal layer is the more superficial layer, and the visceral layer is up against the heart surface itself. And in between the two, it's like two layers of saran wrap, and you put a drop of oil in between them, so they move very smoothly and reduce friction. So in total you have 3 layers of tissue surrounding the heart. The fibers on the fibrous pericardium will attach to the diaphragm inferiorly. This is all for protection and reduction of friction. So layers of the heart wall, this muscle arrangement is very efficient, and if you take a washcloth and wring it out, it has the same pattern as this. When this squeezes, because you can see it's going to squeeze longitudinally, right? It's going to wring the heart out like a cloth, and it's very, very efficient, and it expels more blood than if it was just like circular. So the structure of the heart walls, the left ventricle, since it has to pump out to the body, is far thicker than the right ventricle. And the wall between the right and left ventricles is called the interventricular, because it's in between the ventricles, septum. Interventricular septum. Okay. There we go. So here's the gross anatomy of the anterior heart, and it looks like there's a lot to know, but once you get used to it, it's not all that bad. This is the right atrium here. This is the right ventricle. This is the left atrium. This is the left ventricle. And here's that anterior interventricular artery that we talked about. This is the circumflex. This is the right coronary artery here. So these are the great vessels that enter and actually make a part of the wall of the right atrium. It receives deoxygenated blood from the superior and inferior vena cava. This is from the upper part of the body, and this is from the lower part of the body. So this is the superior vena cava right here. And this is the inferior vena cava right here. Right here. Okay. The brachiocephalic trunk is the first branch off of the aorta, and this will go up to the right arm. Then there's the left common carotid artery, which will go up to the neck and the brain. Then the left subclavian artery will go to the left arm. This is actually called the ascending aorta, and it's only about 1 inch long. This arched part is the arch of the aorta, and then the rest of it is the descending aorta. And it's posterior to the heart, you can't see it. So blood is collected into the right atrium from the vena cava, right? And then there's a septum inside the heart right here between the atrium and the ventricle. And there's a valve here. And this is the tricuspid valve. And blood will flow through there into the right ventricle. Once it's in the right ventricle, it will now be ejected into the pulmonary trunk. This is the pulmonary trunk right here. That will branch into the right and, the left pulmonary arteries. Any blood vessel that leaves the heart is an artery. Any blood vessel that enters the heart is a vein, regardless of whether it's oxygenated or deoxygenated. So the pulmonary veins that come back from the lungs now have picked up oxygen, so they're red, and there are a pair of them, 2 left pulmonary veins here, 2 right pulmonary veins here. These will empty into the left atrium. This is the left atrium here. Now you'll see this word auricle. An auricle means little ear. It's like an overflow section of the chamber of the atrium. It has very little significance. Here's the auricle of the right atrium here. It just allows more space in this chamber. Then this will be ejected into the left ventricle through the bicuspid valve. and then that will be ejected into the aorta to go to all of the systemic circulation. So here we have ascending aorta right here, pulmonary trunk right here, pulmonary veins on both sides, right atrium, right coronary artery, anterior cardiac vein. We already went over these. Right ventricle, marginal artery, small cardiac vein here. And on this side, there's a little ligament here between the arch of the aorta and where the pulmonary trunk splits into left and right pulmonary arteries, called ligamentum arteriosum. That just holds things in place. Here's your left pulmonary artery, pulmonary veins, left atrium, auricle, circumflex artery, we already saw, left coronary artery, left ventricle, great cardiac vein, anterior interventricular artery, and the apex of the heart down here. So you just need to get used to these. It's really, I promise you, not as difficult as it seems. But now we're going to cut the front of the heart out, and we're going to look at what the chambers look like inside. So we do have 4 chambers, 2 atria, 2 ventricles, and we have the right heart over here and the left heart over here. These are separate pumps that are kind of glued together with this interventricular septum. That's it. So in the right atrium, special features here are this fossa ovalis, which is just a depression really left over from prenatal times. When you're a fetus, you don't need to pump your own blood. You get it from your mother because a fetus can't get oxygen. So there's a hole or a foramen between the atria, and this will heal over when you're born, and if not, then they have to go in and seal it up. The distinguishing feature of the right atrium are these pectinate muscles. They only reside in the right atrium. Great test question. Pulmonary veins out here. Okay. Then we have the atrioventricular septum right here. A septum is just like a doorway, a dividing wall between one place and another place. So on this wall there's a valve, and the valve is called the tricuspid valve. Tricuspid because it has 3 cusps. Okay, 3 leaves, if you will. And these leaves have little tendons attached to them, and then there are muscles attached to the tendons. As with all muscles, they are attached to tendons. Only these aren't attached to another muscle, they're attached to the leaves of this valve. And they keep the valve from prolapsing so that it doesn't tear, and so it functions properly. The other feature of the right ventricle is, well, trabeculae carneae. This is in both chambers, both ventricles, and it's just this texture in the walls of the ventricles, and supposedly it's there to help mix the blood so it doesn't become stagnant and all of it leaves the actual chamber. So these tendons here, these are called chordae tendineae. You will definitely be tested on that. Chordae tendineae, that's these tendons, and these muscles are papillary muscles right here. Oh, here, papillary muscles. Okay, they're the same on each side. So on the left atrium, you just have these the foramen for the left pulmonary veins. Sorry. And then at the atrioventricular septum here, we have a valve called the mitral or bicuspid valve. This valve only has 2 cusps, a cusp or a leaf We can take pictures, we can show pictures of those in a moment. Again, we have the chordae tendineae and the papillary muscles and the corneae trabeculae. This is the interventricular septum once again. This is myocardium. And that's all there is to that. It's not that much. Now here's the posterior side of the heart. This is where you see all this plumbing business here. And once you understand it, it's not that tough. So from the right ventricle, we have the pulmonary trunk, which you can't see, branching into left and right pulmonary arteries. Now this is left and this is right. So those are going to run off to the lungs, right? Pulmonary, pulmon means lungs, so off to the lungs. And when they come back as in a pair, okay, on each side. These are the pulmonary veins. The two right pulmonary veins, the two left pulmonary veins are going to enter the left atrium, right? Left atrium right here. This is the auricle of the left atrium. Left atrium. Then that's going to pass through the bicuspid valve, go into the left ventricle, and out to the aorta. So here's the inferior vena cava and the superior vena cava, and you can see how this actually forms part of the wall of the right atrium. Okay, so this is called the atrioventricular sinus here. This area, it's like a sulcus, right? So this sulcus contains arteries and veins. It's a great place to hide these vessels. This is the right coronary artery here. This is, what are they not saying? Left circumflex, probably. This is the coronary sinus. So the great cardiac vein, right, posterior vein of the left ventricle, middle cardiac vein, they all converge in this area, and they go right into the right atrium over here. So it's going to return to the right atrium because it's deoxygenated blood, and that's just going to get pumped out to the lungs and reoxygenated. Okay, not that hard. So the heart, double pump, has a pulmonary circuit, a systemic circuit. The atria receive blood from the pulmonary and systemic circuits, and the ventricles are the pumping chambers. So I've already been through all of these separate parts, so I'm not going to do them again. The right atrium forms the right border of the heart. It receives blood from the systemic circuit, right? But it's deoxygenated, and the superior and inferior vena cava is the blood plus from the coronary sinus. The auricle is a separate part of the main atrium known as the atrial appendage. It's just an extra little tiny space, room. Auricle means little ear. Okay, right atrium has pectinate muscles. They're just ridges. Okay, and I don't even know if they're really muscles. But they're ridges inside the chamber, and they're associated sometimes with the auricle. And then this fossa ovalis, which is a depression in the interatrial septum. That means that would be the wall between the two atria. And it's a remnant of the foramen ovale. You need to know this. This foramen is patent or open between the two atria before you're born. As soon as you're born, that closes up. I mean, within hours. Okay. The right ventricle receives blood, goes through the tricuspid valve. This has trabeculae carneae, papillary muscles, and chordae tendineae. The left atrium has the mitral valve. The left ventricle has the aortic semilunar valve. This goes into the aorta. The flow of blood through the heart, you should know this by now, it will begin with the inferior vena cava, superior vena cava, enters the right atrium, goes through the tricuspid valve into the right ventricle. from the right ventricle, it goes through the pulmonary valve, the pulmonary semilunar valve, goes up the pulmonary trunk, divides into the left and right pulmonary arteries. That will come back through the pulmonary veins on either side. So that'll have 4 holes here. Right? That blood will go through the bicuspid or mitral valve into the left ventricle, and that will be ejected through the aortic valve into the aorta. You need to memorize that. You need to memorize all this stuff. So the heart beats approximately, this is approximate, 7 to 80 beats per minute at rest. Systole is the word they use to describe the contraction of a heart chamber. So when your heart pumps actively, it's called systole, and when it relaxes, it's called diastole. Systole and diastole also refer to the stage of the heartbeat when the ventricles contract and expand. The heart valves are composed of endocardium with a connective tissue core. The AV valves, that's the tricuspid and bicuspid, because AV means atrioventricular. Atrioventricular, that means it's between the atrium and the ventricle. Okay? The aortic and pulmonary valves are at the junctions of the ventricles and the great arteries. And these are all semilunar, so they have 2 cusps. There's a fibrous skeleton that runs between the 2 atria and the 2 ventricles. It's made of connective tissue, and you can actually dissolve all of the organic portions of the heart, and you can be left with this dense connective skeleton, which is kind of white and fibrous. And within that are anchored all of these valves. Okay? It prevents overdilation of the valve opening. These valves are critical. They're a life and death. The valves have to operate perfectly, or you will be very, very sick, or you'll die. So these have to be anchored perfectly. Also, the origin and insertion of the cardiac muscles are on this fibrous skeleton, and it blocks the direct spread of electrical impulses. So it has these 3 main functions, or 4 functions, that are critical. This is what they look like. You can see the myocardium here. It's originated and inserted. So it's anchored in there. The muscle is anchored in there. The valve, see there's a ring around each valve, and these cusps are anchored to the ring. This is fibrous tissue. This is epithelial tissue. The leaves of these valves are very thin, but they're waterproof, and hopefully they're leak-proof. So the fibrous skeleton, you can see some of the fibers here, and all around here like this, and then around these 2 valves as well. Okay, and that's for that. So the function of these valves is to allow one-way passage of blood in one direction only. So as the pressure increases in this chamber, it will push the leaves of this valve, inferior ward, and then when this chamber opens up and fills up with blood and starts pumping, the back pressure will push the leaves back up, and they'll shut. I'll have to show you a picture of that. So the ventricles contract, forcing blood against the AV valve cusp, and it'll push. It'll fill these like little parachutes, and the force will push them up. And then these tendons keep it from overexpanding and pushing these valves out this way and ripping them. So these need to remain very functional. So the health of your heart includes the health of these muscles, the health of these tendons, which is connective tissue, yes. The health of these valves, yes. So any of these components that are not healthy is going to cause a dysfunction in this system here. This is a system. So, proper nutrition, exercise, exercise and nutrition is everything. People get bad valves. Smoking will deteriorate these, alcohol, not getting the right nutrients, not resting enough, not exercising enough. You know what I mean. Everybody knows these. So the functions of the semilunar valves are just about the same. They don't have chordae tendineae. Once the blood is ejected into, say, the pulmonary trunk, it's prevented from backflowing. Okay? And the same with the aorta. And it's just the pressure of the next heartbeat that will push that blood farther. You can see that the back pressure here is contained within these cusps. And the microscopic anatomy of cardiac muscle, we saw this before. We have intercalated disc. I'll always ask that. It has the nucleus right here, and this is endomysium. The intercalated discs allow an action potential to flow more rapidly and to be spread out. Remember, we also have these branching. This branching and intercalated discs. And the way it's designed, all I want you to know is that it's designed to spread the action potential very, very quickly. These gap junctions allow for calcium to diffuse rapidly. And that's all. This is what actually forms the intercalated disc, are these gap junctions. So not all cardiac cells are innervated, but it'll contract in a rhythmic manner without innervation. You can take the heart right out of a person's chest and it will keep on beating, but it's too slow of a rhythm to maintain life. And this is called inherent rhythmicity. This is just the cells themselves will beat. You can cut the heart in little pieces, it'll keep beating. And this is the basic for the rhythmic heartbeat. So your heart will remain beating, but it will be too slow to maintain life. For that, you need to increase the heart rate. And for that, you need sympathetic, right? Autonomic sympathetic innervation. So the cardiac muscle has an intrinsic ability, that means an automatic ability to generate and conduct impulses. And it has a conducting system. This is to make your heart rate faster or slower. So we have a series of specialized cardiac muscle cells in little bundles or nodes. The first one is called the sinoatrial node. This will set the rate of contraction. So this node will be innervated by sympathetic and parasympathetic fibers, which will constantly increase and decrease the rate. So the sinoatrial, so it's in the atrial sinus of the right atrium, right? And it's going to send out an action potential in these different directions. One of these directions is just inferiorly to the atrioventricular node. Atrioventricular, right? This is another node. So you need to know these two nodes. Then the action potential will travel down the the interventricular septum, right? This will branch into left and right sides. This will continue down. This is called bundle branches, or you may have heard it as bundle of His. We'll call it bundle branches. This is the right bundle branch here. As it wraps around, it's now called Purkinje fibers. Okay, so this is the left bundle branch here, and then that will branch into Purkinje fibers. Okay, so sometimes you'll hear there's a left bundle branch block. So there's a diseased part of the muscle here. It interfered with this nerve conduction, and now this part of the muscle is not being perfused or innervated, so it won't contract, and then you're going to have a problem, right? So sinoatrial SA node, AV node, bundle branch or bundle of his. So this part is the atrioventricular bundle or bundle of his, and then these are bundle branches, and then these are Purkinje fibers. So the innervation, you can see this is the medulla oblongata. Remember, the lower the part of the brain, and medulla oblongata is the first part of the brain, the lowest part. You'll have a nuclei in there that will go to the spinal cord, down the spinal cord rather, the thoracic spinal cord. It's going to exit into the sympathetic chain, and that'll be your sympathetic innervation, right? The parasympathetic is going to come from the dorsal motor nucleus of the vagus nerve. Remember, parasympathetic has a long preganglionic neuron. Its ganglia is on the surface of the heart, and then it's going to innervate the sinoatrial node. So there's dual innervation to the sinoatrial and atrioventricular nodes. You'll notice also that sympathetically we have innervation to the left ventricle. So we need to know parasympathetic is vagus and sympathetic is fibers from the thoracic chain ganglia. Sympathetic chain ganglia. We already learned that. Yay! So heart sounds, we call them lub-dub or lub. I don't know how I say that. I say it's lub-dub. Okay, this is the sound of valves closing. There are other theories about what makes the sounds, but we'll just go with it's valves closing. So the first sound is the lub, and this is the atrioventricular valves closing. The second sound is the dub, and this is the semilunar valves closing. They should be simultaneous on both sides. Each valve sound is best heard near a different heart corner. If you want to hear what the pulmonary valves are doing, you're going to go to the superior left corner. Now you have to remember where those four corners are. The aortic valve is in the superior right corner. The mitral valve is at the apex, and the tricuspid valve is at the inferior right corner. And you can listen on the chest in those specific areas and hear those specific valves, and you're listening for leaks or heart murmurs. So here are the four corners, and you're listening to the different valves. It's kind of cool. So disorders of the heart, yeah, we have problems with the heart. We have coronary artery disease. You've heard of it all the time, caused by a buildup of fatty plaques called atherosclerosis in the coronary arteries, resulting in decreased blood supply to the myocardium of the heart and diminished heart function. The causes of coronary artery disease may be lifestyle or genetic. The first step is to make lifestyle changes. If this is insufficient to open the arteries, then surgical intervention may be necessary. So atherosclerosis is that fatty deposit. Angina pectoris is chest pain only and may not be indicative of a heart problem at all. It just means chest pain. A myocardial infarction is the fancy name for a heart attack, and that means that some artery has been blocked and the muscle has become ischemic, which means it lacks blood. It's possible there's no pain and you can just drop dead. And this loss of blood supply to a portion of the cardiac muscle, so that portion of the muscle will die. Heart failure is the progressive weakening of the heart. It can't meet the heart's demands for oxygenated blood, and there are many reasons why this can happen. It's usually in the cardiopulmonary circuit, some kind of resistance, or even a bad valve. Congestive heart failure, this is where the heart enlarges and the efficiency declines. So the perfusion of your tissues decreases and you get sick. Cor pulmonale is the enlargement and potential failure of the right ventricle. That's the blood that's going to be pumped to your lungs, and that's quite important. And that's it for that.